We've created the most widely used patient-reported outcome measure for the knee called the IKDC subjective knee form. And by incorporating that into clinical practice, it allows us to see how we're doing with our patients and use it for identifying opportunities for quality improvement.
Dr. Irrgang is about patient-reported outcome measurements, and he's done research in that regard over the last probably 30 years or more.
Probably most importantly, the administrators and the payers really want this information so that they can identify the value of the services that we provide. We were definitely on the leading edge of using patient-reported outcome measures in standard clinical practice.
He's always pushing the surgeons, the physical therapists to collect data that really reflects on what we're doing well and what we're not doing so well. And then he implements that from a quality improvement perspective. One of his biggest impacts in the department has been creating a performance improvement project for students. So they collect data, they reflect on their patient outcomes, and then they create a performance improvement plan during their third-year internship. That project is unique and not replicated in any other university.
The Pitt PT program is number one. Our students are extremely well prepared to manage any types of patients the day that they graduate. With our clinical education, we expect our students to be functioning at the level of a competent clinician, to hit the ground running the first day they're in the clinic in their first job.
Jay will treat the most important people who come into our area and need a physical therapist. Jay is one of the most productive researchers we have. Multiple times has been NIH funded. He now has a number of Department of Defense grants. He is creating science, and Jay has never shirked his responsibility in the classroom.
I don't know if I've ever met anybody with a stronger work ethic, more drive, more passion.
When I imagine back in 1998 when I first read about Jay, I never imagined I would be sitting next to them one day and do research, collaborate with them, do surgeries with them, physical therapy, all of this. And Jay is truly a hero, and I cannot say enough good things about him.
What I hope for the future of the field is that physical therapists become positioned as a first contact provider for patients with a variety of acute and chronic conditions.